Let's talk about the whole process of history taking. If you're taking history, when a scenario is given to you, initially you start with uncertainty. If you can look on the screen here, you will be uncertain. You don't know what is happening. But later, when you start asking open-ended questions or closed-ended questions, you will start getting awareness about the particular scenario. So you read the scenario, you don't know anything, you're thinking about a list of differentials. You don't come to a diagnosis yet. Never come to a diagnosis just by reading the scenario. I think this is what a lot of amateur doctors or medical students or doctors who don't think at next level do, is when they read the scenario, they think, yes, this is a case of myocardial infarction, or this is a case of pulmonary embolism. That is when you will fail. 100% you will fail. Very rarely you will pass when you come to a diagnosis just by reading the scenario. For me, I read the scenario, I think these are all the possible diagnoses, then I am uncertain of things. So my plan is to go inside, talk to the patient, rule out my differentials, and come to an awareness stage, which is the second stage here. So now I'm aware that the patient has these problems and I have ruled out this. So now this is the problem. Then finally I connect all the insights by examination, by asking for appropriate investigations, and then I manage the case. So don't be like that, first year medical student or second year or third year medical student who just reads a scenario and tells this is a case of deep vein thrombosis because the patient traveled for 8 hours. So there might be changes in the scenario. So never ever come to a diagnosis just by reading the scenario. Your plan initially is you should be uncertain, then come to a bit of awareness, connect all the dots together, then manage the case. If you think like this, you will be a safe doctor. You will pass your OSCE or clinical exams easily. I wish you all the best. Make sure you subscribe to the channel, and I will give you so many videos on how you can pass your clinical exams or OSCE and be a successful doctor and good clinician in the future. I will see you in the next video.